definitely it is there, osteoarthritis. And a couple of the two important things here is, one is the life expectancy is gone up in India. So there is a good number of a old age population is there. And then awareness of this joint replacement surgery is there nowadays. The information is available for the public, so they don't want to, they need not live with pain, and they want a good active mobile joint. So that way they want a pain-free life, so they want surgery. So definitely there is a need for joint replacement surgery, and with a lot of more and more insurance companies also supporting joint replacement surgeries, definitely there is a big need.
So can we have some kind of a percentage or something like that in terms of number of increase over the years? How is that increased?
The increase has been phenomenal. I think the growth rate has been like 300% or something like that in that range. So earlier on we were doing about, talking about Indian, I don't have Tamil Nadu numbers.
Fine.
But I think we are doing about 30,000, something like that. Now we do like 200,000 over the last, increase over the last 4 or 5 years.
Okay.
So we do about 200,000 knees a year, all over India.
How is the cost aspect being changed, or how is it being looked at from the patient's point of view as well as in terms of treatment point of view? Like, how is it being? Of course, as you mentioned, insurance is playing a big role today, and more insurance agents, companies have come into support. How has that changed?
That's a very easy question, because the government has recently regulated the price of the implants. So whatever implant that you give to the patient on the primary,
That's only off late. It's around
off
3
late,
to
yeah,
6 months.
off late is just right, yes. But that is streamlined everything. So all implants are the same price. So whichever company that you use, the same price, and it has benefited the public to an extent, I would think. Yeah.
But even before that also, it was not very costly. This thing when compared to the Western countries, in India definitely the costs were not that high.
While comparing the cost within the Western countries and India, it has always been economical over here, and that's why we see a lot of patients also coming down to India for treatment. Probably that cannot be taken as the norm, because of the fact that there are a lot of people on the other side as well, like economically on the lower side over in India. So that could be a factor that we can look at. So with the government regulation in terms of the cost of implants, that could make a factor. But then in terms of overall facilities and how it has also changed.
I think the number of middle class, as you said, the earning capacity of middle class income probably is much better than what it was earlier.
Yes.
And because the government has sort of pitched in to help the persons with lower income group, the number of people who are able to access the treatment has definitely increased. So I think it's that's one of the reasons why the numbers have increased. And plus a lot more number of trained surgeons, and so it's more widely available. Otherwise it's available in a few centers, now it's available in every city.
Moreover, coming back to the cost, it is not only the cost factor, it also we need to do look at the research and the innovation which has to happen. We cannot just keep on curbing the cost, so that the innovation and research we need, so to keep up the pace, and a lot of demands are increasing. More and more younger patients are undergoing surgeries, more revisions. The whole program today is about revision surgery. So we are going to see more and more surgeries. So we need a lot of research and innovation for newer implants, technology, training, all those things. So that also we have to consider.
That would be my next question, basically. Looking at how, in terms of the research which is happening in India, because there will be a lot of the difference in terms of even the structure, the bone formation in Indians when it comes to others as well across. And how is it being panned out? How is it growing over the years, and how are we equipped in India to handle this?
We are very much equipped with dealing with that. As I said, the bone structure is totally different from Asians to the Caucasians and other places. So definitely it is different scenario. So we need a lot of research, innovations according to our need. So for that we need help from every quarters, like from the patients, the government, the infrastructure, research modalities, everything has to be looked into.
And in terms of research, has there been any funding coming in? Are there more from the government's end or from the private end?
Whatever research is being done is done by surgeons on their own interest. And government funding as far as research in revision replacements or replacement is nil.
I'll come to the revision part
Yeah.
later. As of now, like we'll start.
But government funding as such is not there, and it is only by private players that whatever research is happening, whatever inputs, whatever papers are presented are by surgeons who are doing huge numbers, and they are all private sector players only.
This is, as Rajkumar was saying, the cost, is now the honeymoon period because in 6 months it looks like a win-win for everyone. But down the line, we'll find that we lose out on research and innovation because there needs to be, somebody has to fund it. It's part of that. So if we keep on, regulating costs, it's good in one way, but the downside or flip side of it is that we lose out on cutting-edge technology, innovation, and the companies will just refuse to bring it to India. So that's what they're worried about. Even now, they find that companies are not interested in funding, very expensive implants because they can't charge that much. It's regulated. So some implants are not used commonly. They're not able to bring it now. So that's going to be the flip side in the years to come.
I think it is happening in the cardiac stent already.
Yeah.
The companies like Abbott have stopped giving him the stents, newer stents to India now. So it will happen in orthopedics as well if this approach continues.
That's correct.
The price limiting is very good, but I think it should stay only for the people who cannot afford it. There is a sector of people who can afford it and who want technology. Depriving them of what is being latest, I don't think is moving in the right direction, and we will not be able to get whatever the latest is as far as implants are concerned, as far as technology is concerned, if we are going to just look at price cutting and cost cutting. Cost cutting can happen, frills can be cut, but not the basics. So there's a lot of difference between where you're reducing the price and how you're going about doing it.
Good. So coming to the replacement surgery, like in terms of revision surgeries. So how has it been growing? So India has a new, knee surgery itself is probably comparatively lesser in terms of the time frame that had been happening in India. Say around 10 years now, if I'm not right, if I'm not wrong. Much longer. Okay. So how often do we come across a revision surgery?
The volume of
Volume.
As of now, it is not growing. But if you see any other trend, like in Western countries, so you'll have a wave of primary, which happened much before in the European countries, for example. The wave of
So the age group as well, like so. What happens?
No, I'll just finish that. So 10-15 years following the primary wave, you get the revision wave. Yeah? That's how it's happened and panned out in all other countries. Yeah. So they're not yet seen the revision wave, but it's down the hill. So it's now the in time coming. Yeah, because wave of primary maybe 10 years now. Primaries are exploded in numbers. The revision wave will be following it 10-15 years. Yeah. We're still not with that, but we're moving towards that. Yeah. Down the line, we're going to see the real, large number of revision cases, and I'm not sure that we're all equipped to really handle that. Especially now the government funded schemes in Tamil Nadu, a lot of primaries goes in, that's fine, but who's going to do the revisions? That's all they need to think.
So how far away are we for that wave to come? Say a couple of years, 5 years.
Maybe about 5
5
years.
years. 5 years is average. Yeah, it's better.
You're talking about the prevalence. I think if you really look at it, it's 1 in 10 who actually hit the age of 60 and up over is likely to have significant arthritis. So the primary number is going to increase even more from now. That's going to hit the revision number even more. That's probably why we're conducting this meeting, so that the primaries, which are going to increase more, are done more properly. But the revision rate should actually go down. I think that, as Dr. Bose mentioned, the primary number has exploded in a slightly uncontrolled manner because this government-funded scheme. A lot of primaries are being done in many centers. The revision is going to increase. And really, we do not know that we are prepared to cope with the revision because the cost of revision is roughly double the primary. That's the other problem.
3 times. In fact, 3 times, 3 to 4 times.
And I think the capping the primary prosthesis may not be the right option. Better option would be to increase the number of primaries in a controlled manner in the government sector, where the economically disadvantaged patients can actually access those surgeries without cutting the cost of the private sector. Because cutting the cost of the private sector actually is sending a wrong message. You're not actually increasing the number in the government sector, and the private sector is the one who actually is going to cope with the revisions, at least for the next 10 years. Because the government sector is not geared for primaries to the maximum level what they can, let alone the revisions. That's a problem in the future.
Any other point of view on this, or are we all on the same thing?
You're on the same one.
At the end of the day, it has to be balanced.
That's right.
Uh,
It's not working.
Is it?
Yeah, I think this is working.
Okay.
But to Leffler's point, I think we have this international surgery.
So compared to European situation, the levels, the numbers of primaries increased dramatically 15 years ago. Now we are on a certain level of 150,000 knee arthroplasties each year, on a population of 80 million, more or less. So it's not increasing anymore, but we're facing more and more revisions. About 15% of my daily practice is revision surgery due to the increasing numbers 10 years ago. And each year in our population, in average, 3,000 citizens need a replacement of knee and 3 need a replacement of hip. So that's a number each year of new primaries, and the revision rates growing up with the primaries. The patients get more aged and more requirement of primaries as well, and revisions for sure. And we cope with the costs as well, because the revision implants are much more expensive, and the whole procedure at least triple the price for primary. It's not just the implant itself, the treatment around is much more challenging, and needs more input from brain, manpower, education, and money.
I suppose that gives a perspective. The population is 80 million you're talking about. They're doing 150,000 giants per year. Our population is how much? Sorry?
1.2 billion.
So you can imagine the number of primaries actually need to be done. It's not that the arthritis is less common in India. It is equally, is quite common. But the access actually is not that good. I think the only way to cope is to have a bi-pronged attack, both the government side doing more primaries and the private sector doing more primaries. And there's a lot of training programs like these go on to equip those surgeons. That's the main aim of this program, is to equip those surgeons in the next generation. We're getting these experts to share their experience on the primary, so that we want to reduce the number of revisions, as we know is quite expensive.
So where do we go from here? Like in terms of cost, in terms of surgery, in terms of need is there. Okay, in terms of government also chipping in with their support in terms of having primaries done as well as private as well, doing it together. So where do we go from here? Like how do we see? What do we see in the future? In the near future?
See, World Health Organization announced bone and joint decay between 2000 and 2010. It's back in 2000. India actually signed into the WHO treaty in 2008 in Pune. And the 4 main categories we wanted to concentrate was spinal back pain, road traffic accidents, osteoporosis and osteoarthritis. Now we are in 2018, which is the second bone and joint decay. 2010, 11 to 20 has also been announced for bone and joint decay. And the osteoarthritis is one of the 4 main problems we're going to face in orthopedics. Osteoarthritis, for which the definitive treatment is the joint replacement. The rest of the treatments are not definitive treatment. They postpone the joint replacement. The cure for advanced arthritis is joint replacement. So the commitment actually we are expecting as the body of orthopedic surgeons is more and more time spent on training the future surgeons, which actually need money. For example, this meeting has been conducted with the support of a company and by the hospital that Arvind has kindly consented for conducting this program. But these programs have to keep on going. And for that, there should be a commitment from both the government sector and the private sector. Just by cutting the cost of the implants alone, this may not be the solution.
Just one more regarding the cost. Again, that not only, as he said rightly, that not only cutting the cost, the government can look at improving the infrastructure and training of the government hospitals, where the real patients who are all not able to afford a treatment outside, definitely they can get a good quality treatment. So in the government hospital also, so they can even look at improving the infrastructure and also training the government doctors as well. So that will really help in a big way in near future.
In terms of the age groups, what we see as prevalence, so what could be the age group and how different is it from international patients to in India?
In India nowadays, joint replacements are being done even in the age group of 50s.
Okay, is it due to morbid obesity or is it because
The multiple factors. It is very difficult to pinpoint one single factor. Multiple factors, awareness, everything put together. So because the need is there, because as you cannot live with pain, so definitely patients are undergoing joint replacement surgery. So the proper training will in fact streamline the whole process. That's what I feel.
So the essence is the prevalence actually hasn't changed.
has been
Awareness has increased and more people recognize that it's a cure for advanced osteoarthritis. That is a successful treatment for osteoarthritis. If you really look at the quality of life improvement after joint replacements, it ranks number 2 in all the surgical procedures. The first operation is coronary artery bypass graft, revascularization procedure. Second is total knee. Cataract actually comes third. There are so many programs for cataract from the government side to reduce blindness. But the joint replacements actually has not been given the right recognition by the government and the funders to say that this is actually a healthcare issue across the country. It's not an operation for the elite anymore. It's actually an operation for quite a lot of people.
It has been considered like that all the time.
Absolutely. I think it has to change. The joint replacement numbers is going to explode in a significant manner. Not because of prevalence increases, because people's acceptance. And the good results being brought by a lot of the surgeons is percolating to the more wider public. So more and more people are going to come and knock the door. And they want to reduce the price. But the private sector cannot keep on reducing the price. We really have to look at the government sector to increase the numbers by providing a good joint replacement surgery, which needs infrastructure and the appropriate trained doctors to be in place.
I think anything that we can add on that? No?
One message. Yeah, for the public, yeah. So as I said, the prevalence has not increased, but the age group has certainly come down. So that's probably due to obesity, sedentary lifestyle, poor diet, and all the things now, modern lifestyle, so-called modern. So although obesity is not as a big problem here as the Western countries, we are coming there. As a message to the public, yeah, they have to look after their knees, good lifestyle, good exercises, no, obesity. All that is very important. Otherwise, what we used to see in 65-year-olds, now we are seeing 55-year-olds. That you got to blame the lifestyle, because genetically we are the same. Okay, thanks.
Thank you so much.